Extract 1. Questions 1 to 12.
Good morning, Doctor.
Good morning. Please be seated. Is she your daughter?
Yes, Doctor.
What's her name and what's her complaint?
Her name is Tiara. She gets shortness of breath with vigorous play and exercise. She gets tired more quickly than the children of her age.
Does she have coughing, wheezing, or chest congestion?
No, Doctor.
What's her age?
6 years old, Doctor. Moreover, when she runs in races, she seems to have severe problems, as it seems to take her a significantly long period of time to catch her breath.
Was she admitted to any hospital earlier?
No, Doctor. She needed an apnea monitor after birth, and this was continued for approximately 3 months thereafter. At times, she has nasal congestions during the night and morning hours.
What medications is she taking now?
Nothing, Doctor.
Is she allergic to any medicine?
No, Doctor.
Her immunizations are up to date?
Yes, Doctor, but she is yet to have influenza vaccine.
While her pulmonary function test shows premature ventricular contraction, it is 1.21 liters, that is 77% of predicted. The FEV1 is 1.9, that is 81% of what we've predicted. Peak expiratory flow is 175 liters per minute, that is 82% of predicted. Post-bronchodilator, she has no change in the forced vital capacity, or FEV1. She had a 10% improvement in the peak expiratory flow up to 195 liters per minute. Her forced expiratory flow is 25 to 75% increased to 2.5 liters per second, which is a 28% improvement. Her borderline normal lung volumes as measured by the forced vital capacity and FEV1 and her flows are in the normal range, although there is some improvement seen post-bronchodilator. This would indicate that she has some airway reactivity. I have reviewed her recent chest x-ray. I've also reviewed the echocardiogram report, which shows normal. She has developed dyspnea with exertion, etiology unknown, may be reactive airways disease, a potential cause. She has rhinitis, probably vasomotor and infectious. I am going to start albuterol HFA as ProAir and Proventil 2 puffs via Inspir Ease every 4 hours and 15 minutes prior to vigorous exercise. She can use either Claritin 10 milligrams or Zyrtec 10 milligrams daily for rhinitis symptoms, and she may also use Sudafed 30 milligrams every 6 hours for significant nasal congestion. Continue these medications for 2 months and meet me thereafter.
Okay, thank you, Doctor.
Extract 2. Questions 13 to 24.
Hello, doctor. Good morning.
Good morning. May I know your problem?
Well, I'm having asthma and facing difficulty in walking even 10 steps. My weight is 344 pounds. I have high cholesterol and high blood pressure. I have joint pain, back pain, foot and ankle pain, and swelling on my leg and foot. I have sleep apnea and snoring. Moreover, I am a diabetic patient on medication. I also have hemorrhoids, doctor. I am also pursuing surgical attempts for weight loss and to become active in my life again.
What's your age?
37, doctor.
Okay, do you drink or smoke?
I do smoke, and I have stopped drinking alcohol a year back.
Have you undergone any surgeries earlier?
I underwent orthopedic knee surgery, doctor.
Can you brief me about your family history of diseases?
All my family members have obesity, heart disease, and diabetes, and negative for hypertension and stroke. But I am using Chantix to come off smoking completely.
Okay, tell me about your food habits.
I eat things like bacon, eggs, and cheese, cheeseburgers, fast food.
How many times do you eat in a day?
I eat 4 times a day, 7 in the morning, at noon, 9 p.m., and 2 a.m.
Well, the ideal weight for your age is 184 pounds, and you are weighing 344 pounds. That means 184 pounds in excess. What medications are you taking?
Diovan, Crestor, and Tricor.
Do you have any chest pains or any mild attacks?
No, doctor.
Well, your cranial nerves 2 through 12 are intact. Neck is soft and supple. You have positive wheezing bilaterally. Heart rhythm is normal. Abdomen is soft. You have 1+ pitting edema. I have reviewed your complete test reports. This is a clear case of bariatrics, and you need to go for a laparoscopic Roux-en-Y gastric bypass. The complications include infection, bleeding, pulmonary embolism, deep venous thrombosis, leakage from the gastrojejunal, anastomosis, and possible bowel obstruction. Before we proceed for the surgery, you need to get reports on upper endoscopy, H. pylori testing, thyroid function tests, LFTs, glycosylated hemoglobin, and fasting blood sugar.
Okay, doctor. I would like to proceed with the surgery.
Part B. In this part of the test, there are 6 short extracts relating to the work of health professionals. For questions 25 to 30, choose answer A, B, or C, which you think best fits according to what you hear. Question 25. You hear a junior nurse talking to a senior nurse about a patient's potential death. Now read the question.
Would you listen to my analysis of this patient, please?
Yes, I can.
Mr. Swain was admitted with a contusion to the rib cage following a motorcycle accident in the early hours of this morning. He was rushed here from the scene in an ambulance and remained unconscious throughout. His vitals are stable with the exception of his blood pressure, which is high. According to the doctor's notes, it's equally likely that the patient will pull through this as it is that they won't make it. As such, we shouldn't be so quick to conclude that the patient is going to die. His next of kin have been contacted, and his wife is on her way here as we speak. Does that sound like an accurate summary of this patient's condition, based on their notes and this chart?
It does. Thank you.
Question 26. You hear 2 nurses talking about an alcoholic patient. Now read the question.
You won't believe what I'm dealing with here.
Uh-oh. You look stressed.
It's Rosemary Granbury. She's back again after going on yet another bender last night. Ugh, dealing with alcoholics can be really draining sometimes.
Has she been here before?
Only a dozen times. The last episode was in May when she had a liver transplant. She was on constant watch because of her dehydration, which is when we actually noticed that she needed a donor urgently. You'd think that would have been enough of a wake-up call, but no, here she is again after picking fights at bars all night.
Wow. Still, I don't think it's our place to judge. We'll have to care for her, just like we do with our other patients, and hope she can make better choices moving forward.
Question 27. You hear two senior members of staff at a hospital talking. Now read the question.
Would you check something for me?
Yes, sure. What is it? You can ask me absolutely anything you'd like to, so long as it's not for a bed on this ward, because we're jam-packed like you wouldn't believe.
Oh, I'm wondering if there's any space left for just one more patient.
You have got to be kidding! Did you not just hear what I said? Seriously, I wish I could help, but I just don't think it's possible. The last I checked, there were 11, no 12 patients still waiting to be warded. Your patient's going to have to get to the back of the queue, I'm afraid.
I was hoping you wouldn't say that. He's been waiting for 4 hours already. I doubt either him or his already annoyed mother-in-law are going to be too pleased about this news.
Question 28. You hear an obstetrician speaking to a pregnant patient. Now read the question.
Come on in, Mrs. Fernando. Please take a seat.
Thank you, Dr. Fellows.
I have your file from Dr. Reynolds, but would you be so kind as to tell me, in your own words, the reason for your visit today?
Yes, you know I'm 6 weeks pregnant, and whilst I'm thrilled at the news, I'm absolutely petrified at the thought I'll be a mum again soon. You see, my late husband, Jean, passed away recently, and I don't know if I'm ready to be a single mother. I have a bridge partner called Eric, who's offered to pitch in, but I know he's just being a gent about the whole thing. I doubt he's planned to take up any real sort of paternal obligations. I think everyone would be better off if I just accept things the way they are and start looking at adoption options.
Is that the reason you've booked the consultation today? Would you like me to help you explore that?
Yes, I think I would.
Question 29. You hear a conversation between a patient and his GP. Now read the question.
I've not seen you in a while. How can I help you today?
You mean besides the obvious?
Oh, right. Let's take a look. You know, I've not seen full-body injuries like this since my days as a trainee on the wards.
Not used to dealing with athletes, then?
Not for a while. That looks pretty swollen. You're an athlete, right? Which sport?
Soccer.
Were you playing when this happened?
Yeah, I had a game that didn't end too well. As well as losing 3-0, I managed to hurt myself too. Ordinarily, I wouldn't want to bother you, but I have a nasty feeling that my finger is broken, so I came here to get it checked out.
Let's take a look.
Question 30. You hear a conversation between two nurses. Now read the question.
Hi there, you must be Lindsay. I'm taking over from you.
All right, great to meet you. If you don't mind, I need to rush. Please don't forget that Bed 9 has quite a few care needs and is on a schedule. He'll need to be checked before 9 a.m., 12 p.m. and 3 p.m., okay?
Got it. Any idea what the most urgent needs are?
He'll need a saline IV. I just did one for him, so this can be left until noon.
Okay. Any medication that I need to be aware of?
Yes, he's taking lisinopril BD and will need this topped up at some point in the afternoon.
Got it. He's got scans coming up too, right?
Yes, he'll need an MRI first thing, so better get ready for that.
At 9, right?
Yes.
You hear an interview with a radiation therapist called Roger Atkins, who treats patients with cancer.
We are talking today with radiation therapist Roger Atkins, Programme Director of Radiation Therapy at Hull University. So, Mr. Atkins, why do we need radiation therapists?
Cancer encompasses over 125 diseases. In the UK alone, over 1 million people will be diagnosed with cancer this year. Approximately 70% of cancer patients will receive radiation therapy. The goal of radiation therapy is to eradicate cancer cells, while at the same time sparing normal cells. Because radiation therapy is such an important part of treating cancer, there is a growing need for competent, caring radiation therapists in all parts of the world. As a medical radiation professional, it can be confronting to experience loved ones going through cancer and radiation therapy. But it is also very important the way that we communicate and deliver education to patients throughout their cancer journey.
What inspired you to become a radiation therapist?
My career as a radiation therapist is directly linked to my own mother dying of ovarian cancer during my junior years of college. She was diagnosed with cancer when I was a college student. As I accompanied her during cancer treatments over the next 2 years, I learned about the various people who worked with cancer patients. I remember the radiation therapist who treated my mum. He was a very compassionate man, a good communicator. He was always happy to listen to her concerns and anxieties. Listening to him, the way he worked with my mum, It had a lasting impact on me. Although I was originally a history major, I came to the realisation that my life's work would be working with and caring for cancer patients. From this personal experience, I chose a career in radiation therapy.
What does a radiation therapist do?
A radiation therapist is a valuable member of a cancer treatment team who delivers radiation treatments to patients, helps construct treatment plans, and works with cancer patients and their families. Cognitive psychomotor and effective thinking skills are used every day. When a patient is treated with radiation therapy, they can only receive a limited amount of radiation dose each day. Consequently, it takes anywhere from 2 to 8 weeks for a patient to complete their treatment regime. Because they usually see the one patient 5 days per week for so many weeks, radiation therapists often develop close relationships with their patients. The radiation therapist also needs to be able to plan, evaluate, and assess several parameters for each patient every day. The radiation therapist will also assess the patient's reaction to treatment, providing advice on the side effects of treatment and methods of alleviating these.
Can you describe an individual case to us?
Well, I recently treated a patient called Susan. Now, Susan was quite comfortable in the radiation therapy setting because she herself had previously worked in a radiology practice. She even went as far as to tell me that she felt cared for in that environment. Her husband, however, had a different reaction to Susan's radiation therapy altogether. He found the linear accelerator confronting. He had trouble reconciling radiation dose as a cancer-killing mechanism. After all, doesn't radiation also kill you? And thought the advances of science would mean that Susan would not be treated on an imposing machine in a concrete bunker.
What would you say is the most rewarding aspect of your career?
First, seeing and speaking with patients who I treated 10 to 15 years ago and having them give me a hug is very rewarding. Second, as a radiation therapy teacher, I see the accomplishments of our program's alumni and the many lives they have touched, cared for, and helped cure. We are very proud of each graduate. Their work is noble and greatly benefits humanity. When I teach, I don't only talk about radiation therapy, but I also discuss how the use of radiation can benefit mankind and improve the quality of our lives through both medical imaging and radiation therapy.
And finally, how do you see the future for radiation therapy and cancer treatment?
Well, I think quite a lot about the importance of research focusing on patients' perspectives and improving the way that we communicate and deliver education to patients throughout their cancer journey. It may well be that patients are nervous or anxious when they present to radiation therapy because they have had a difficult experience in another health setting or perhaps have already experienced chemotherapy side effects. Then there's the issue of patients who have a family and young children. Patients in this situation face a quandary in deciding what to tell their children, and each patient manages this experience differently. Many parents want to protect their children from distress and so do not communicate with the children about their illness, or they give them limited information. However, clear and open communication in an age-appropriate way emerges strongly across a number of studies, and quality communication between parents and children is associated with emotional health when a parent has cancer.
Now look at Extract 2. Extract 2, questions 37 to 42. You hear a GP, called Dr. Edward Symes, giving a presentation about how the condition called myalgic encephalomyelitis, ME, affects young people. You now have 90 seconds to read questions 37 to 42.
My name's Dr. Edward Symes, and I've come to talk to you today about a complex illness called myalgic encephalomyelitis, usually referred to as ME, and its effect on teenagers and adolescents. ME is a chronic neurological condition that affects many body systems, causing a variety of different symptoms, almost always including pain, feeling generally unwell, and sleep disturbance. I'd been working as a GP for about 20 years when my own daughter was 14 or 15, and one of her friends, let's call her Emma, was diagnosed with ME. She'd taken weeks off school, and none of her friends really knew what the problem was, other than that she was tired and not very well. The problem had started with a nasty bout of flu that she never fully recovered from. As time went on, Emma's friends seemed to abandon her one by one, as it became clear that even the shortest or most moderate forms of mental or physical exertion worsened her malaise and exhaustion. She ended up being excluded from almost every social activity, as she just couldn't cope with any exertion. The impact of this on her physical and mental health troubled me, as there seemed to be very little understanding and tolerance for her condition, and she was falling behind academically as well as socially. It was a chance meeting that resulted in me deciding to specialize in ME. One day, I bumped into Emma's mom at the local pharmacy, and we ended up talking for almost an hour. She was clearly desperate for someone to talk to. It was having a huge effect on the family. She'd had to give up her job in order to take care of Emma, as her anxiety was made much worse by being at work when her daughter was sick and alone at home. It's well documented that ME is a physical disease, and there's no evidence whatsoever to suggest that it's psychological, but there's so much misinformation, and there's no therapy or cure. Emma's friends had apparently spoken about her skipping school or getting out of things that she didn't want to do. There seemed to be a general feeling that she should toughen up and get on with school life as they had to. As a result, poor Emma's confidence had hit rock bottom. She felt that people saw her as lazy or attention-seeking. That's when I decided to turn my attention to researching the illness. Somebody who's so ill shouldn't have to worry about proving it to everybody. Another extremely unhelpful aspect of the illness is that it's so difficult to diagnose. What we really need is a valid laboratory test we can use. At the moment, we just have to go through the patient's medical history, analyze their symptoms, and try to exclude other illnesses. Sadly, this often means that many young patients suffer the illness for years before they're diagnosed, which is a shame because an earlier diagnosis helps to reduce the impact through support and intervention. Another issue is that ME can be tricky to identify in younger patients as they don't always report symptoms accurately. The seriousness of the condition can be hard for them to judge, as they may think that feeling exhausted or ill is normal and have learned to pace themselves and simply take part in fewer activities than they would if they were well. A reliable blood test would avoid all of these problems and might mean that the illness finally gets the attention it deserves. Perhaps the most challenging thing about having ME is the fact that it's so erratic. You just don't know how you'll be feeling at any given point in the future, which makes planning difficult. This often results in sufferers missing school and key social events. Feeling left out at a time when you're trying to establish your identity can trigger confusion and depression. And let's not forget that they do all of this on top of having to cope with debilitating medical symptoms. That's why I really want to emphasize that teenage sufferers require a lot of support and understanding from their families. For example, help with managing their social lives and visitors, because it can be difficult to keep friendships going. Another important point is that they shouldn't be put under too much academic stress, made to help out a lot at home, or keep up with physical exercise. A lot of parents think they should soldier on, but that's often the worst thing they can do. Trying to battle through is likely to lead to a total crash and a prolonged recovery. Sadly, there's no intervention or therapy for ME, but that doesn't mean that as health professionals, we can't help our patients to manage the symptoms and improve their quality of life. We need to be willing to try several and work out what makes the symptoms worse, what makes them better, and help the patient achieve a balance in their life so they can improve their daily function at such an important time. Because the symptoms vary from patient to patient, there isn't one single method that can be used. Patients want and need a GP who at least validates the illness and acknowledges its effects. They also appreciate us providing ongoing support and regularly reviewing and monitoring progress. We should be giving appropriate documentation and information to the family and school so that our patients are more likely to be believed. The patients themselves need to be involved in the process and adapt to life with the illness by respecting their physical limits and allowing themselves adequate rest. Before I go, I want to briefly mention one controversial method of treatment that is sometimes prescribed, and that's cognitive behavioral therapy, or CBT. Whilst it's been helpful for some pediatric patients, the effects on teenagers are modest at best. Claims that it can cure the illness are not supported by any follow-up studies. The theory behind it is that the patient is so frightened of the illness that's usually brought on by exercise that it worsens their health. CBT can be used as a way of getting back into exercise. However, the illness cannot be worsened by attitudes, and this theory goes against current understanding of the disease. It has led to patients being blamed for their failure to recover, and even worse, it frequently leads to severe relapses, as it usually insists on some form of exercise. On a final, relatively positive note, I should say that the majority of severely affected adolescents make a full recovery, and most others improve sufficiently to lead near full lives.
That is the end of Part C. You now have 2 minutes to check your answers.